Hi, Mrs. Jones-Muna here. Today we're going to talk about pregnancy complications due to rhesus factor, Rh, incompatibility. Are you a pregnant woman and you have a rhesus negative, Rh factor in your blood type? You may be at risk of developing some complications associated with the rhesus incompatibility. Among these complications are bleeding during pregnancy, miscarriages, ectopic pregnancies, hemolytic disease of the newborn, HDN, kernicterus, brain damage to the child due to high levels of bilirubin, hydrops fetalis, fluid buildup and swelling of the baby, problems with mental functions, hearing, speech and seizures. What is rhesus factor? The rhesus factor, Rh factor, is a certain type of protein found on the outside of blood cells. People are either Rh positive, they have the protein, or Rh negative, they do not have the protein. This distinction mostly matters when you are Rh negative and your child is Rh positive. What is rhesus incompatibility? Rh incompatibility occurs when a woman who is Rh negative becomes pregnant with a baby with Rh positive blood. With Rh incompatibility, the woman's immune system reacts and creates Rh antibodies. These antibodies help drive an immune system attack against the baby, which the mother's body views as a foreign object. The incompatibility happens only if the father of the child is Rh positive. Note, the first pregnancy is not affected since the body has not been sensitized into producing the antibodies, but the second pregnancy and the pregnancies which may follow will be affected. However, if you had an abortion or miscarriage, still your body shall have been sensitized and as such you will be affected. Why is rhesus factor important? This protein does not affect your overall health, but it is important to know your Rh status if you are pregnant. Rh factor can cause complications during pregnancy if you are Rh negative and your child is Rh positive. Who is at risk of rhesus incompatibility? A woman who is Rh negative is at risk for Rh incompatibility when she becomes pregnant. Rh incompatibility happens only when the father of the baby is Rh positive. Men are advised to know their Rh status if their spouses are rhesus negative. What causes rhesus incompatibility? A difference in blood type between a pregnant woman and her child causes Rh incompatibility. Children may be Rh positive if they inherit the protein from their father, even if their mother is Rh negative. What is the treatment for rhesus incompatibility? Treatment of the child who is already affected depends on the severity of the condition. Infants with mild Rh incompatibility may be treated with phototherapy. For immunoglobulin may also be used. For those who are severely affected, an exchange transfusion of blood may be needed. Thanks for listening.